Welcome back to the Ageless Pet Podcast. This is your host, Dr. Gabby Barco.
And Dr. Carmen Balsani.
And today we're going to dive into a topic that's been hotly debated in the veterinary community about spaying and neutering your dog. It's a topic that's been getting a lot of attention from veterinarians, pet owners, breeders. Everybody has an opinion. And just like many things in life, the science around it isn't as black and white as we might hope. So we're going to try to unpack some of the controversy surrounding this topic and just what some of the research is actually telling us.
Yeah, it's an important topic because on the one hand, spaying and neutering can help reduce a number of problems, obviously unwanted pets, and they can have some benefits as well. On the other hand, there are some concerns that these procedures might have long-term health effects that we're only now starting to understand. Gabby and I were talking earlier, I think this is probably over 10 years when the first stuff started coming out about spaying certain large breed dogs later for growth issues. And since then, there's been more and more and more research. And so the answer of just spaying and neutering your dogs at a certain age for all dogs and all types and all lifestyles, just like everything, there's not a cut and dry black and white answer for anything anymore.
Right.
Anything.
Yeah. Yeah. And this is definitely one that even looking at all the research, we're not going to have an answer.
Yeah. We were just looking at, I don't know how many research papers before we started recording. And again, it's multifactorial.
Oh, there's so many things.
You have to think about what dog you have, what your lifestyle is, etc. So,
yeah.
Anyways.
So what is spaying and neutering?
Oh, yeah, I should say that. No, so spaying and neutering. So typical spaying is removing the ovaries and the uterus of a female dog. That's called an ovariohysterectomy. That obviously takes out any chance of reproduction, takes out the uterus exactly. Like I said, there's also another common procedure called an ovariectomy for younger dogs where we just take out just the ovaries and leave the uterus in. And then neutering is basically removing the testicles for male dogs.
Yeah.
Now, commonly, you'll say spaying, you'll throw the term neutering, and neutering refers to both males and females, or it can refer to just males if you're talking about spaying and neutering. But if you hear the term neutering, it's both.
Yeah. And these are reproductive organs, but they also have an endocrine gland effect, and that affects, normal metabolic and metabolism in the body, behavior, musculoskeletal health. It has a lot of general health effects.
Right. And if any of us have been paying attention to a lot of things about HRT or hormone replacing therapy as we get older, some of us might be over 50, some of us might not be. But anyway, so there's more and more research on the benefits and some pitfalls with those things. So
yeah.
But let's first talk about why we're spaying and neutering, and the procedures are recommended obviously for pet population control. That is the one reason why they're recommended widely. But according to the American Society of Prevention of Cruelty of Animals, the ASPCA, millions of pets are in shelters, and many of them are euthanized every year due to pet overpopulation. And we see this, and spaying and neutering is really important to reduce these numbers. And I think we all remember that during COVID, you couldn't even buy a puppy if you wanted to.
Yeah.
There's so many people getting puppies, and unfortunately all of us in the health field or the veterinary health field were concerned that there was going to have a rebound effect that as people went back to work, their shelters are going to get full again. And guess what?
Yeah.
That's what happened.
Yeah.
So we don't want a lot of unspayed animals. We don't want a lot of pets that are not wanted, right? Because that's not fair for them.
Yeah. So, that's a great reason.
Right. Exactly.
But here's where the controversy starts, because it's not just about population control. It's the timing of the procedure plays a big role. And for many years, veterinarians recommended spaying or neutering dogs at a young age, usually would do it around the 6-month mark. And in rescue situations, they'd be spayed or neutered even younger. And what we're finding now is that studies are showing that early age spay-neuter may not be the best choice for dogs.
Right.
Yeah.
I think when I was in school, mind you, that was a while ago, but when I was in school, it was 4 to 6 months. And then they started spaying them really early because they were in the shelters, et cetera. And then I think one of the first problems we started seeing was this female urinary incontinence, or estrogen-associated urinary incontinence, where they were spaying them so young that the estrogen in the body wasn't there enough to really develop the urinary sphincter, and these animals would be starting to leak, everywhere.
Yeah.
So anyway, so that was a problem, and more recently, I think the big thing that came out. Gosh, you're going to hear some papers rustle here.
Yeah, because there's just so much.
There's so many papers. But when did this come out? I can't remember when this came out, but it was sometime in the middle of last year. WSAVA, the World Small Animal Veterinary Association, came out with a position paper on spaying and neuter. And, at the end of the day, they said, this is one of the summaries, the decision to spay, neuter, or sterilize dogs and cats require careful consideration. While the temperament and health of each individual animal plays a significant role, the setting in which the decision is made, as well as the future living environment of the animal, are all important considerations. Recommendations for reproduction control procedures may vary across different settings and are summarized below, and they go into it. But there are a lot of, it is not cut and dry anymore.
Right.
So it's not just everybody gets spayed at a certain age.
Right.
And I do think that a lot of veterinarians or a lot of integrative practitioners definitely have been recommending spaying and neutering later in life. So instead of doing it at 6 months, we're trying to get their growth plates closed so they're fully grown. And so a lot of people were doing it at 12 months of age. Big breed dogs might be 18 months of age. I think I've seen some as far as 24 months of age.
Yeah.
But I think it depends on the size of the dog. But I think in general, a lot of the recommendations now are waiting for a little longer for them to get some hormonal development and so forth.
Yeah, that's what I'm seeing a lot of people now recommending is just saying let them meet skeletal maturity and then make good decision.
Exactly.
Yeah, but let's just talk about a little bit of the science behind this. There was a 2019 study published in Frontiers in Veterinary Science, and it looked at the long-term effects of early spay-neuter, and they found that for some dog breeds, early spay or neuter might increase the risk of certain health issues, such as like hip dysplasia, cranial cruciate ligament tears, behavioral concerns, and then certain types of cancers. And it's a really great paper because it goes through a lot of the different breeds and if you spay and neuter and if you don't. And so it's a really complete paper. It's a really good reference to have, but they pretty much just looked at all the data and said, yeah, you're going to have these joint disease, you're going to have cancer, you're going to have other behavioral concerns if you spay neuter and, when you do that.
Right. And I mean, there are a lot of different papers, and most of these papers are easily, you can find these easily just by a quick Google search. But another one that was published, I think 2 years ago now, can't remember, but it was comparing vasectomies, ovary-sparing spays, which is essentially hysterectomy, and regular spaying or regular neutering and not neutering dogs. So long words, but basically dogs who had their hormones, their gonads, and dogs who didn't. And this is a study that compared over 6,000 dogs.
Yeah.
That's a lot of freaking dogs.
It's a great paper.
Dogs. So it is a really good paper. It was published in the Journal of American Veterinary Medical Association under Chris Zink, I think is the head author. So you can find it pretty easily. But the summary was longer exposure to gonadal hormones, regardless of reproductive status, was associated with reduced odds of general health problems, both problematic and nuisance behavior. So health problems and behavior problems. The longer they had their gonads in, the less problems they had. That's a big summary because of the topics. There's a lot of things to unpack in that paper.
Yeah.
The paper's not that big, but it's, I don't know, 15 pages or something like that. But I think the numbers, the different topics we were considering, and these, we'll go over some of these, but for non-neoplastic topics, do you want to go over some of the ones that are mentioned in that paper and other papers as well?
Yeah, so neoplasia is cancer. So non-cancerous conditions will be obesity, low thyroid, hypothyroidism, incontinence, like you were mentioning before, cranial cruciate ligament insufficiency, so that's ACL in people, hip dysplasia, behavioral problems, a variety of behavioral problems, including cognitive dysfunction, because we know the rate of cognitive decline worsens if they're spayed or neutered compared to intact. And then one that has been, they go back and forth, is diabetes mellitus. So diabetes has been like, are they at higher risk? Are they not? So, and then, the neoplastic conditions, the cancerous conditions that they're, higher risk of. There's quite a few there if you want to kind of name a few. I know we'll get into.
But the interesting thing too, though, one of the things that Gabby just said was certain behavioral problems, right? And it's really funny because, I mean, how many times do you hear that if you neuter your dog, they're going to become less aggressive?
Right.
And so a lot of these papers are showing just the opposite, that neutered dogs, and again, when I say neuter, I mean neutering, spaying and neutering. So just catch-all term. But a lot of these papers are actually suggesting that and it definitely is breed dependent. So I think the German Shepherd and the Vizsla are two that I think have been studied that have shown that if you spay and neuter them early, they'll have more fear-based aggression and more nuisance behavior. So a lot of people are coming in wanting to neuter their dogs because of aggression, and I'm not so sure it's going to work.
Right. Yeah, it doesn't always work. And some of it isn't, of course, a lot of it is hormone driven, but some of it too can be personality and can be other factors. So if somebody says, oh yeah, just neuter them and they'll be fine, that's not always the case. And we've seen that.
Yeah, I've seen so many wonderfully behaved, unneutered, large dogs, like pit bulls, unneutered pit bulls who have been the most well-behaved dogs in the world. And I don't really know that I could say that, unneutered Rottweiler versus a neutered Rottweiler. I mean, I think there's this general feeling out here as veterinarians in the United States. I think that if this is an international podcast and
let's
people
clarify that in the United States.
Yeah, in Europe or in wherever, the Czech Republic or South America, I think they'll have a very different take on what we think of as aggression and so forth. You're from South America, and my wife's from South America, and there are a lot of unneutered dogs there. And I don't think aggression is a big problem that I felt anyway. So I don't know.
And something is that as humans, we have to take ownership that we can create and worsen behavioral conditions in dogs. I know it's a little bit of a stretch, but like we have to take ownership in that too. Like you have to train and you have to give them manners, you're still, you have to do the right thing. And some of that is going to be influenced by hormones and things like that. But we also have to take the time and say, hey, we're going to train them to be well behaved.
Certainly. That's for sure.
So, it's just a big debate. Do we wait to neuter them? Do we keep them intact? And if we do wait, do we wait till they're skeletally mature? So I think, which is different based on different breeds because of the size. And so it's just, it's a constant conversation to have.
I just think that, there are lots of cancers and so forth and behavior issues and obesity and endocrine issues. And it's not surprising. Anyone who's an integrative veterinarian who's thought about these issues and looked at these increases of all these different situations, and conditions, I think it's hard to not look at spaying and neutering as being associated with it. But I think to come up with a blanket statement, which I have heard on several other podcasts and read and several other, what do you want to say, holistic publications, to not spay and neuter your dogs just in general, I think that's not necessarily, it's so non-nuanced, it's so black and white that I don't feel that that's, I don't think that's the way medicine should be. It shouldn't be black and white, nor should healthcare of anybody be so black and white. So I think that we need to look at a lot of these different things, and we can go into some of them, of course, too.
Yeah. And we talked about, the benefits and then the adverse effects. And it's certainly something that, that we have to look at on an individual basis.
Yeah. I think one of the things that we were talking about that, the obviously unwanted litters is really important, but if we don't spay female dogs, I think one of the things, the most common cancer, and I can't remember the statistics, you may remember, but mammary cancer is a huge problem in female dogs.
Yeah.
So I think it's the most common cancer.
Yeah, like 50 to 60%.
Yeah,
are malignant.
And
which means that there's a significant risk for it spreading to other parts of the body. And then the percentages of, if you let them have a heat cycle before you spay them.
Yeah, no. So those are different. So we got the number of estrus cycles before spaying. If you did no estrus cycle, then uterine cancer is like 0.005, an odds ratio 1, 2, or more. From 1 it goes to 0.08 to 0.26, and this is a percentage, so 8 to 26% intact. Obviously, a lot more. So the interesting thing with these things is that obviously this is a relative risk, but spaying female dogs significantly reduces the mammary cancer, and certain dogs are at a higher risk. And I think I read what boxers, dachshunds, English spaniels, Springer spaniels have a high risk of mammary cancer, if I'm not mistaken. So that's just one of those things to figure out. For male dogs, I mean, what's your risk? I mean,
it's your risk for male dogs. It's more compelling to say keep them intact, and then for females, it's just more complicated.
right, like everything with females.
Of everything, we're just so complicated.
So, anyways, though, but yeah, the males. I mean, honestly, for us human males, as we get older, obviously prostatic cancer is one of the things that we worry about, right? But in dogs, it's just the opposite, actually, that neutered dogs have a higher risk of prostatic adenocarcinoma and cancer than unneutered dog, which makes zero sense from a human standpoint. Right. But so male dogs, it's really more about lifestyle, et cetera, right?
Yeah.
Females, I think the risk of pyometra, which is a uterine infection, obviously goes up. I think you said something. What did you say earlier about the risk of death from pyometra? It's like 4%.
Yeah,
or
it's
something.
really low.
So
And
pretty low.
it's one of those infections that it's, pretty easy to diagnose, easy to treat. You spay them, in some cases, medical management, depending on the case. So, but it's not something that's going to be as fatal.
Yeah, the only bummer about pyometras is that they don't usually happen in a 2-year-old dog. It's usually like
I know.
that 8 or 9 or 10-year-old dog, and now you're having to make a decision of spaying your 8 or 9 or 10-year-old dog. That's how I got my second pug.
Oh.
For exactly that reason. She was pyometra for quite some time, was not treated, and then became really sick. So then we had to hospitalize her, and they didn't want to keep her.
Yeah.
So, and I've already had one other one-eyed pug, and there's another one-eyed
Well,
pug
there you
who
go
came
now.
in, so it's clearly
Together.
calling my name.
Together, you have one good set of eyes.
One good head on a
Yeah.
pug. So anyways, though, with female dogs, right, that's a tougher situation.
It is, because there's just so many factors. It's, the incontinence that you talked about. You've got your mammary cancer is less of a risk if you spay them, but then you have other cancers that are more risk if you, bone cancer, osteosarcoma.
Yeah, I think there's no perfect age, no perfect setting to spay and neuter. And there are a lot of factors. One thing to consider is emerging research in alternatives to traditional spaying and neutering, like those of hormone suppressing drugs that could provide a middle ground between the benefits and the risk. So in this country, we don't see a lot of that. There are some, for about years ago it came out, but I guess in the U.S. it's not a big thing. We don't see it a lot. There are some, I can't remember what the ingredient is, but it used to be called Nutrasol. And in other countries, they do have intratesticular injections that you can give to a dog that will, a male dog that will cause it to go sterile, but still have its testicles.
I do remember that.
Yeah, in other countries, it's still being used. In this country, there are some things that are that help with GnRH, gonadotropin releasing hormones. Sorry, easy for me to say. That are antagonists to that can be injected, once a year to decrease the hormonal effects. So, that's something to look into. We don't use that a lot in the United States. In other countries, I know that they do. So it's not my area of expertise, but certainly there are some other alternatives to spaying and neutering.
Yeah.
And, we were talking about it before the show, but as far as males, I mean, obviously, if you want to keep your male dog intact, then do it. If you want to spay them, I mean, neuter them, then that's fine too. But if you want to be somewhere in the middle, then you can do a vasectomy.
Yeah.
The hard thing with a vasectomy is that there's not very many people who are trained in doing vasectomies.
Yeah.
I don't think they're training them in veterinary schools now. At least what I've heard, they are not. And there are a few people who are doing them.
In large animal, they will, because when I was a vet student, I learned how to do a vasectomy on a goat. So we had to do that because
Well, why do they do that? Just
so we could learn the technique, but we didn't do it in dogs. So I think it just depends, and I don't even know if they're still doing that. I don't know
why they would do that in goats. I don't know anything about goats.
I mean, they probably just did it because the structures are big and they're teaching us. I don't know that it was specifically because it was goats, or maybe I'm wrong.
And in females, that's the other thing too, right? So you can leave them intact if you want. And we were just saying, though, to be aware of tumors. And I believe a general statistic is like 25% of dogs, female dogs, will develop mammary cancer. 50% of those can be cancerous. But if you're going to leave them intact, then watch for mammary growth.
Yeah.
So you have to do routine
absolutely
breast cancer screens. That's not hard. Dog's on his back, you pet his belly, or just when you're pelling if you feel.
And you could really tell, like those nodules are really firm and prominent. Like you could really tell there's a difference.
Yeah, it's not usually a question. It's a hard mass.
Yeah.
So if you are going to leave your dog intact, then definitely scan for mammary cancers frequently. Even if you're doing an ovary sparing spay, where you keep the ovaries in and take out the uterus, then you still have to do that, right? Because you eliminated the risk of pregnancy, but you still have the hormones, and those are the hormones that are creating the potential for mammary cancer. So I guess one of the things to say is if you're leaving them. So if you're going to leave a dog, especially female dog, unaltered, or leave the ovaries in, you just have to do mammary checks and check and bring them in. Just be aware that you will be doing that, and there is a certain percentage of dogs that are going to need to have secondary surgeries, mammary tumor removals, etc. But that is something that you need to weigh, again, in light of what breed of dog that you have.
Yeah. And it's just, you should be checking your dog for lumps and bumps anyway. Exactly. And I mean, these alternatives are still in the research phase, but it's exciting to think that the future might bring some really reasonable, less invasive options that still address the population control issues, but minimize some of the health risks that we've talked about today. So it's something we'll definitely be keeping an eye on. But for now, it's just really important that everybody stay informed and keep an open mind and have that conversation with your veterinarian, because I think it's a constantly evolving thing.
Oh my God.
But the more research that comes out, the trend towards keeping your dog intact, especially if they're male, if it's right for you and your household and everything like that, it seems to be trending that way, or at least letting them reach skeletal maturity.
Yeah, I think the longer you can leave them intact, the better. And realize that, being a general practitioner as well, I've seen lots of people, we talked about this and said that maybe it's better to leave them intact, but it's not right for everybody.
Right.
Some people it's fine. Some people don't like bloody vaginal discharge. Some people, there's increased risk of urinary marking. Some people want to take their dog to dog beach or dog parks or doggy daycare.
Yeah, like you were mentioning before.
Right. And doggy daycare, I think some people know this. They would think just the opposite, but neutered male dogs are not fans of unneutered male dogs. So unneutered male dogs get picked on all the time. So that is one of the things that happens in San Diego, where we are, that because we do have dog beach and dog parks, and so their dogs get beat up on. And so that sometimes is a reason to do that. But again, I mean, if I lived in the wilds of Canada or something, maybe I wouldn't. But it's a little bit more difficult, so it's nuanced as well, for sure.
Yeah, so a lot of adverse things that happen health-wise. Cancer, that's the big one. So if you have a dog who's neutered at less than a year of age, it increases the risk for osteosarcoma or bone cancer.
Right.
Then there's also increases of hemangiosarcoma.
Yeah, I mean, I think we were talking about that. Neutering triples the risks of hypothyroidism.
Yeah.
So that's a huge increase. Now,
And
hypothyroidism was, sorry.
no, it also triples the risk of obesity.
Oh, yeah. Oh, I didn't see that. That's right. Triples the risk of
Yeah, so
obesity.
both.
Yeah, increase. So obesity and hypothyroidism kind of go hand in hand. And I mean, thyroid, obviously, you can treat that pretty easy, but it's also not great to have to treat your dog
Right.
for anything,
Right.
if you don't have to.
Right.
So,
And then you've got your increased risk of orthopedic disorders. And this is all with neutering male dogs. Like,
right.
let's just. And then one thing that I was not aware of that I learned in doing the research for this episode was it increases the risk for adverse vaccine reactions.
Yeah, I had no idea.
I just thought that that was really interesting because that's
Yeah.
not something I would have put together.
I never would have thought that.
Yeah. So,
But yeah, in orthopedic disorders, as Gabby was saying earlier, the ACL thing, we read a study earlier that showed that dogs, well, we read it before we started taping that, dogs who aren't neutered have a significantly decreased risk of rupturing an ACL than dogs who are neutered.
right.
And that's an important thing because I swear if there wasn't ACLs in dogs, half the surgeons on the planet would be out of business.
It's the most common orthopedic
by
surgery
far.
and condition that we see.
By far. So on the female side, if spayed before 2.5 years of age, there's a significant reduction in developing mammary cancer.
Yeah.
So, I mean,
That's-
2.5 years, that gives you quite the window to think about
Yeah.
what you're going to do. I like to say after, a year and a half, but this study actually goes into 2.5 years.
Yeah.
So, I mean, every heat cycle increases the risk. But I think up to 3 or 4, I can't remember exactly the number, but still 2.5 years, significant decrease in that.
Yeah. So, I mean, it's a pretty common one, unfortunately, and
Right.
a high malignancy rate. But again, if you're checking your dog regularly and you have this conversation with your veterinarian, that's certainly something to keep in mind.
Right. Obviously, removing the ovaries will remove uterine and ovary cancer. That's pretty obvious if you spay your dog, I should say. On the negative side of female spaying, if spayed before 12 months of age, significantly increases the risk of osteosarcoma.
Yeah.
So osteosarcoma, hemangiosarcoma, mast cell tumors, lymphoma, those are kind of big cancers in dogs, right? I mean, I don't know. I'm not an oncologist, but that's got to be, if you can add those 4 up, they have to hit
Yeah.
80% of cancers or something. I don't know, large percentage, at least 50%, right? And those are all decreased by at least some margin by spaying and neutering.
Yeah. And we were just saying cancer rates are just increasing.
Skyrocketing.
And so if there is something you could do to help mitigate that, that would be great.
Right. And we were just talking about male dogs increasing obesity triples the risk. It's the same for female dogs. So no difference there.
And obesity leads to so many other health conditions that it's almost like if you can keep them from being obese, then you're going to keep them healthier in general.
Now, we can't say this enough. I say this every day in the exam room. And our very first podcast we did was about this. But the Purina Lifetime study showed that if you kept your dog slightly overweight, the obesity is such a big concern. In our first podcast, we talked about, the Purina Lifetime study where if you are slightly obese versus normal, you will, well, how do I say this the right way? 1.8 years, slightly obese, not obese.
Like what, 6.8 body condition score out of 9?
Yeah. So that will reduce 1.8 years of life.
Yeah. So yeah, just so many things. And then again, for females that are spayed, increased risk for urinary tract infections. And they also have the adverse vaccine reaction. So very similar to neutered males.
Right.
And with a few nuances, but very, very similar.
Right. And one of the things I wanted to mention too, there's this group, and I never say the word right, but I think it's Parsemus Foundation, Parsemus Foundation, and it's parsemus.org. And they have a lot of information on hormone-sparing sterilization. There's a veterinary directory. They talk about pet health, etc. So there's some information out there, but I think at the end of the day, we wanted to emphasize that there is controversy. It's not all one size fits all. Depending on who you listen to, they have their own point of view and their own, I don't know, axe to grind, I guess
Yeah.
you want to say.
Yeah.
But it's not one size fits all. There's lots of papers out there. So if you just Google, effects of spaying and neutering, you can find some negative stuff out
Right.
there, and that's fine. That's things you need to look at. But, it is a lifestyle thing as well. And did I ever read the position statement or the final statement on this? Yeah, it says ultimately the decision to whether and how to spay, neuter, or sterilize your animals should be based on a thorough assessment of the individual animal's health and client preferences. Veterinarians play a crucial role in guiding these decisions, weighing the risks and benefits to ensure the best outcome for the animal, client, and the broader community. So
Yeah.
it's not cut and dry. It is a customized thing to
Yep.
think about.
Exactly. And it's forever evolving. So it's going to be debated. We just wanted to talk about it because everybody's talking about it. So we wanted to jump on the bandwagon, but have this conversation with your veterinarian. Look at the literature, look at both sides of the literature. And
What's right for you
Yeah.
and your lifestyle and your family and all that stuff. And obviously the health of your pet. But
right.
I think it's clear that later spaying and neutering
Right.
is beneficial.
Absolutely.
So I don't think that's up for debate. So
Right.
early spay and neuter, I think is only a convenience factor, but I think later spaying and neuter is clearly the right decision if you are going to spay and neuter. And if you're not, and that's the right decision for you, and you are a responsible pet parent, then that's awesome too. But you
Yeah.
have to be a responsible pet parent for whatever that means.
Be responsible. All right. So thanks for listening. And, we'll probably circle back to this topic a bit again.
Sure.
All right. Thanks.
All right. Thanks, guys.
Thanks.
Bye-bye.
Bye.